I would say we will start and welcome everyone to our panelists and also to our viewers. This is the first of hopefully a series of panels on the consequences of the corona crisis and what our internationalist response could look like. We have panelists from 3 continents here, and I'm very glad that you're all here and join us tonight. And want to talk about like the measures that countries have taken to fight this crisis, and yeah, get an overview what the situation is right now in your countries, and also what kind of measures we can take as political actors, and also how we can support each other. And I would first start with the introduction of our guests. And yeah, I'm Michelle. I'm on the National Board of Jusos, and I'm also a Vice President of the Young European Socialists. Then we have Jessica Bernard, who's a county councillor in the UK and a member of Young Labour. Then we have Justine Belain, who's from Akbayan Youth from the Philippines, and also a Vice President of the Internationalist Union of Socialist Youth. Then we have Giulia Piccione, who is a member or the secretary of Petit Rossi, which is an Italian organization that brings together people that are in several left and progressive parties in Italy and try to do political education. And then we also have Marianella D'Aprile, who is on the National Committee of the Democratic Socialists of America, which is actually the biggest socialist organization in the US, with over 60,000 members and 200 chapters all over the country. And then last but not least, we have Matthias Kreins, who is the chair of Solidarität, which is the organization that is hosting us tonight, and an Austrian organization that wants to bring together and support local branches of the Social Democratic Party with civil society initiatives. And my first question would be, and I think we should start with the 2 countries that have been affected like first and also very severely, which are Italy and the Philippines. And I think Justine can also say something about other Asian countries as well. So maybe Julia, you want to kick off the floor with how the situation is right now in the country, how the healthcare sector is coping with this crisis. So the floor is yours.
Okay, hello, ciao to everybody, and thanks to invite us. So as you probably know, now Italy is one of the countries most affected by the pandemic. Just to give you an idea, the first case occurred on February 21st. Probably the virus was around the country already in January or even November. Since February, we have had, by those are numbers of today, 132,000 cases and more than 16,000 deaths. For lethality rates around 12.3%. The northern region of Lombardy, that was hit the most by the virus, hosts almost the 30% of the cases, which where cities like Brescia and Bergamo are in the middle of a sanitary crisis. There are different reasons and faults, but certainly Lega Nord, the far-right party who has been running the region for the last 25 years, should take these own responsibilities. Years of healthcare organization, the management of the emergency in favor of industrials union, and so the decision to don't stop the production and delay in declaring the lockdown in the first sites where the virus broke down are probably among the major political responsibilities. we have been under a national lockdown since March 9th. The medical staff, of course, is working under extremely pressure. They are tired, sad, and they are insufficient in number, and they don't have enough protection in terms of medical disposal. Since the beginning of the emergency, more than 12,000 doctors and nurses have been tested positive. And they are facing a large number of mental issues like insomnia, panic attack. We have had our first case of suicides for a nurse in North Italy. In 2018, Italy spends around 6.6% of his GDP in public health care, which means basically that in 10 years, the funding of 37 billion of euros. Most between 2010 and 2015 under Berlusconi's and Monti government. The most loss down came from local institutions and human sources, which means that we have lost about 46,000 doctors and nurses in 10 years, and the 30% less of beds in our hospitals. Just to give you an idea, in Italy there are about 6,000 beds in intensive unit care, and by now almost 4,000 of them are occupied by coronavirus patients. So this means few spots for all the other situations, and most, I would say half of those beds occupied by the coronavirus patients are in Lombardy. So there are several reasons why Italy has been severely affected by the virus, but of course years of austerity and spending review have had a huge impact on the quality of the public health care, which is still universal, but of course in strong distress. I think the coronavirus in Italy is showing in different ways that only a fully funded universal healthcare system can manage such a big crisis. Because you need common practice within the country, you need one center of directions, and most important, I think, just a national healthcare can pursue the major public interest and not the one of private companies or individuals. For example, in Lombardy, the gravest episodes of infection have been registered in some privately run retirement houses, where the administration consciously hid the spread of the pandemic without informing the families and stuff like that. If the national service cannot operate at its best because of years of defunding, like what happened in Italy, the virus finds fertile ground not just to spread, but also to enlighten the weakness of the system. And above all, I would say that some political and sanitary choices were wrong. There were a general underestimation and unpreparedness, which, along with the structural problems I tried to talk to you about, are of course the main reasons of the nearly collapse of the social and the healthcare system in Italy, I would say, on all levels.
Thank you. And Justine, you can continue.
So I will be talking about the impact of the pandemic here in the Philippines, and a bit on how governments around the Asia Pacific region responded. But first, I'm going to show you a picture of a community here in the Philippines. It's in my hometown. It's in Cebu City. It's a sign that people in urban poor communities are putting out in their homes. It reads, "We're not scared of the virus. We're scared of going hungry." The pandemic is unfolding itself as more than just a health crisis here in the Philippines. It's also an economic crisis where more people are getting poorer and at the same time going powerless. It's also unfolding itself as a democratic crisis where amidst this pandemic, while people are confused and panicking and uncertain about their future, the government's agenda is to totalize powers under him. And this culminated into an emergency powers bill that was passed a week ago, where the president would have power over local governments, would have power to reallocate and reprogram set budgets from different agencies, giving him about trillions of pesos under his office, and at the same time, a provision that is very vague that could be weaponized against activists who want to expose the truth about how the government is handling this crisis. And in the Asia Pacific, the responses also vary. You know, we have some of the best responses from some governments, like for example in South Korea, in Taipei, where the health systems were upgraded, where there was a serious coordinated system in order to trace and contact and treat people regardless of their economic status, and that's how they were able to contain their virus, contain the spread of the virus, even without resorting to drastic draconian measures. But in here, and in the case of India as well, not only are there massive lockdowns, it was also marked by a failure to provide the basic social services, a failure to provide food and income guarantees for a lot of workers. The public health situation here in the Philippines, even before this crisis happened, is already deteriorating. As of today, there have been 3,660 cases of COVID-19. There have been 163 deaths and 73 recoveries 3 weeks into the community quarantine that started mid-March. But at the same time, during the lockdown, there hasn't been a rollout of mass testing and treatment and accessibility of healthcare to people, beating the purpose of a lockdown. And scientists would say that a community quarantine would also require that governments act fast and pour in resources in order to be able to treat and detect where the virus is spreading and ensure that people get access to the healthcare that they need. But the situation here is that for a population of 104 million, 200,000 Filipinos have to share one government hospital, 2,000 Filipinos have to share one government hospital bed, and 7,000 Filipinos have to share one government doctor. As you can see, a very weak public health infrastructure cannot survive this pandemic. And even with emergency powers and trillions of pesos under the office of the president, the democratic crisis is now unfolding as local governments are being punished for not following the president's orders. And at the same time, until now, there's no full disclosure on where the trillions of pesos are going. You can see how this is a huge exposure of inequality as street vendors, workers are being sent to jail for violating curfew and community quarantine because they are trying to survive. While a week ago, a wealthy and powerful senator who knew he was positive went to a hospital and endangered the lives of a lot of health workers there because he insisted that he be able to go in. And in Philippine laws or in the laws that was passed for emergency powers, when you do that and violate quarantine procedures, you're supposed to be met with penalties. But because he was a senator, the police said that he needs that compassion be given to him. And yet 60,000 people who have violated community quarantine are now in jails. They're saying that they are now in jails because they don't observe social distancing or have violated community quarantine, and yet they're stuck in congested detention centers. So you can see how the governments are now failing to see the point of why we need to contain this virus, and that is to take care of the people, not to punish them, to be more compassionate towards them and ensure that they're given the healthcare that they need. Our message is that suppressing people's rights does not suppress the spread of the virus. So the government needs to have a clear plan that is responsive to the needs of the people, even those who are most vulnerable.
Thanks a lot for your comments on this and talking to us about the situation. I think what we already heard from you two is that it's much more than just like a health crisis, this virus. And I would continue actually with those two countries that have reacted in a very different way and very late. So with the US, with Marianella and with Jess, because your countries tried the strategy of herd immunity. And we've seen that this failed. And maybe you can give us an overview of how the situation is right now. And Marianella, maybe you want to start. And a quick reminder for everyone who's watching, you can ask questions in the Q&A button down there. So feel free to ask away.
Sure. Hi. Thanks for having me. This is great. So yeah, I don't know that actually we could correctly say that the U.S. actually adopted a strategy of herd immunity. I think the more accurate description is that the government is avoiding at all costs having to shut down the economy and doing everything in its means to prop up what was already a failing economy, an economy that never really recovered from the 2008 crisis and was sent into a tailspin by the pandemic. So to start with a kind of overview, as of today, there are almost 350,000 cases in the US, with most of them, or a plurality of them, concentrated in New York, about 123, I think, thousand cases in New York City. And we are seeing, as of today, 10,000 deaths across the country. And we are still not under a national lockdown or anything even close to it. Each state has adopted its own policy. So for example, here where I am in Chicago, the state of Illinois has put in place a shelter-in-place order until the end of the month. Some states have longer shelter-in-place orders, some of them have much shorter. But of course, most businesses, even non-essential businesses, are still open, which means that people are still opting to go to work because most people in the United States, one, don't have enough money saved up in the bank to even last them 30 days. So there was a survey that was conducted just last week that showed that 58% of people in the US can't make it with 30 days of quarantine with the money that they've got saved in the bank. And also, and crucially, most Americans rely on their employer for health insurance. And so if they don't go to work, that means they don't have health insurance, which means that they are even more vulnerable at a time of a pandemic. So I think, just to expand on that a little bit, I think there's two sort of central issues which have come up already with the US healthcare system. One is that there's a for-profit health insurance system that is completely tied to people's employers. And so this creates, this basically makes it impossible for people to be able to actually effectively quarantine, like I said before, because they're depending on going to work to keep their health insurance in this moment. I think the other piece of this is that the vast majority of hospitals in the US are for-profit hospitals. And for the last 10 or so years, we've seen major closures of hospitals across the country, but especially in rural areas. So since 2010, there have been about 100 hospital closures. And 30 hospitals across the country declared bankruptcy in 2019, just last year. So the healthcare system, the infrastructure has completely been decimated. And even stockpiles, emergency stockpiles have been decimated. So to give one really egregious example, after the 2006 SARS outbreak, California started to compile like an emergency stockpile of supplies, including N95 masks, including ventilators and respirators, and including basically portable hospitals with up to 21,000 beds. A few years later, the governor of California instituted an austerity budget that slashed that stockpile. That stockpile was totally dismantled and basically left to expire. For a savings of just under $6 million in the state's budget, which California has a state budget of about $130 billion. So of course, you know, those supplies would not have been enough to deal with the scale and the scope of the COVID crisis, but they would have been one little step in the right direction, and we don't even have that. So just to say one more thing specifically about the sort of health crisis is that, you know, all of these conditions make it so that healthcare in the United States is both extremely difficult to access and extremely expensive. And so most people, especially people who are poor, especially Black people, especially brown people, have all of the comorbidities that make coronavirus so deadly. And so that's what we're seeing in terms of healthcare results. Just to give a few more numbers here in Chicago, so far we've had 86 deaths from coronavirus, and 61 of those have been Black people. And only 29% of the population of the city is Black. So to give you a sense, 70% of the deaths were Black people for a city that has only 29% Black population. So yeah, so just to echo what others have said, I think it's really clear that this pandemic is not a crisis of its own. It's exacerbating conditions that were already leading to a crisis.
Sorry, my mic was on. Jess, you can continue. Thank you, Marianella.
Thank you. Yeah. So just to kind of echo what's been said, like what I think really is clear from our perspective is just that the systems that we're currently relying on just really aren't equipped for these kinds of crises. So we, as you already mentioned, you know, it looked like we were going down a path of pursuing like herd immunity as a response. That seems to have been backtracked on, but obviously way too slowly, as we've seen the cases skyrocket in the UK and the number of deaths as well. Alongside that, you know, Boris Johnson, our PM himself, is in hospital right now with COVID-19. So it's a really kind of unsure time. One of the kind of stark issues here is obviously the fact that over the last 10 years of austerity, we've had the privatization of the NHS, which means the COVID-19 crisis, we already had a crisis within our healthcare system. We had staff shortages of 100,000, 43,000 nurses have been lost from our healthcare service, along with 15,000 fewer hospital beds. And over the past 5 years, I think it's around about huge numbers, 8.8 billion, I think, of the health service budget has gone into independent sector providers. So huge increase in pushing our healthcare sector into the private sector, which means more and more we're seeing shortages where they just aren't equipped to deal with an influx of patients, even in the winter, so let alone a crisis of this massive scale. Alongside that, we've had the complete lack of response of the government into testing. So currently healthcare workers are not able to access testing most of the time. It's gradually being introduced over the last couple of days, but it's things like nurses having to go to IKEA stores and queue for testing there, even when they are showing symptoms of COVID-19. So there is a real risk of our healthcare workers passing the disease between people and patients and vulnerable people because the government has failed to act to protect them. Along with this, like the wider kind of economic impact, the government has been pushing the response of like an individualistic response to say, you know, it's your responsibility to stay at home, and if you aren't staying at home, then you're being irresponsible. And that's kind of typical of the Conservative government, because they're really reluctant to put the onus on the state and on businesses to take responsibility to ensure their workers' safety. So what we've seen is a lot of workers have been forced to continue to travel into work for, you know, risking their own health because they have no job security. We've had 1 million people register for Universal Credit, which is our welfare benefit system. There's a 5-week wait for payment on that system. And these are usually people who are under 25 or women, so it tends to be you know, impacting younger people, people in insecure work, and along with that they tend to be renters. So along with this, we're going to have quite a serious homelessness crisis post this, because the government have refused to protect renters' rights when they find themselves out of work due to the crisis. So obviously it's a huge, it's in every element of society, and I think the learning from this, and it's been a tough lesson for, I think, a lot of people who consider themselves you know, in the centrist area of politics, that the free market is not going to respond to these kinds of crises, and it is not going to put health of the public before profit, and that's something that we need to make sure that we continue to push against, and make sure that they are held to account for their inaction.
So, thanks very much for your comments, and I would end this first round with Matthias, and you can maybe give us an insight more into what it also feels like to be at the front lines in the hospital right now.
Thanks a lot. Yeah, so in Austria we have by now 12,000 cases, at least positive tested people, and 220 dead. Also there, these are, I would say, more the minimum number. We know we also do not have this extensive testing as we have seen it, for example, in certain Asian countries. The reason why we managed to stabilize or flatten the curve at that level was partly because of their proximity to Italy. So we have, it's a neighboring country, and we have been seeing there the situation develop a couple of weeks before, and could take certain measures. And we are also now already several weeks under a draconic lockdown. There are only 4 reasons you're allowed to leave your house or go outside, and that's work, buying groceries or medicine, helping others, or getting some fresh air. And also there you're limited of who you can meet and what you can do. So it's, this is under lockdown. Many workplaces have been closed, schools have been closed, university has been closed, but we have we still had certain production sites open. So this is something, we do not know where the virus is currently spreading. That's a big problem. The whole healthcare sector, including the hospital I work in, it's we shut down a lot of usual services we have. So just the random checks, planned operations, all surgeries, all of that has been closed or very much reduced, so we are prepared. And I think that's, talking about the healthcare system, I think we were not as badly hit by the austerity measures as other countries in Europe after the last crisis. So we have still a quite well working healthcare system that is financed through social security insurances and a few 100,000 people that are without health insurance, 100,000 people without health insurance, but there's no large group in the Austrian society that is denied access to our healthcare system. And I think that's particularly crucial in the beginning, where we have seen in other countries where you have people that have no access to the healthcare system and are particularly vulnerable. And then we have a system that relies very much on hospital care. That's an Austrian specific. There were many recommendations, also good ones, I think, to move more towards extramural care, so care outside the healthcare system with private physicians taking care, like in Scandinavia. But we never made this change, and now we're in the lucky position that we have many hospital beds and many intensive care beds. So, but I think the big difference is in quality, that this is still a working healthcare system in comparison, for example, to the NHS that has been hit so hardly by austerity measures over the last years. I think although there was a fast reaction, we were hesitant in certain crucial points, and they had horrible effects. There's in particular in Tyrol, a mountain region in the west of Austria with large skiing resorts. They had confirmed cases or suspected cases, but they decided not to close neither the bars nor the skiing resorts. And as a result, not closing it has caused half of the cases in Iceland, Norway, Denmark, and also in Austria. A large amount comes exactly from this decision to keep business running rather than to close it early. And we have a green conservative government currently that is taking certain measures, and I think in comparison in particular to something that the crazy idea of herd immunity was not on the table. But you see how much pressure there is from big business to lift the lockdown soon. At the same time, we still do not have a coordinated response to it. So we do not have, we do not know who is infected and who not. We do not have this kind of testing that we saw in South Korea or in Taiwan or China or other Asian countries. And so the big question is, what happens if you now really lift the lockdown? And I think today we had a press announcement and we're somehow starting to loosening the lockdown a little bit, but it's completely unclear because in the hospital, you do not know who's infected and not. The symptoms are not so clear and you cannot be in protective gear all the time. It's just impossible and not everybody can be. So you will have infected healthcare workers, and I work in a children's hospital that's almost empty now. Children are very, very rarely affected, and if they are infected, they have mild symptoms. But in adult care, or the usual patients in our healthcare system are exactly the patients that are the high-risk groups of coronavirus. So how do you prevent people who have a heart attack from going to hospital and catching corona there too? And I think that's the big question where we are looking at is how can you loosen the lockdown and prevent the collapse of the healthcare system? And I don't know if this decision will be met by taking the well-being of the whole society as priority, or if large businesses succeed in opening it up. And I think I do not know until which number of infected it is possible to manage the pandemia. And I think herd immunity before a vaccine, I mean, we're talking then about hundreds and thousands for Austria dead and for millions in larger countries. I mean, these are, and I think it's what, like Marianella said, this will not be equally distributed throughout society. It will affect also others, but these are also already the groups who have these risk factors. Hypertension, diabetes, this is not equally distributed throughout society. So I think the impacts that this has on inequality are huge, and on a national level and even more on a global level. So yeah, I think we will we managed maybe a little bit better until now, but I think the worst still lies ahead of us. And yeah, I don't know if there's a plan. From all I see, there doesn't seem to be a real plan on how we manage this in the future.
Okay, thank you all. I think what we've seen is that this crisis has actually that normal was a crisis, and that it has just reinforced inequalities that have been there before. I mean, we were talking about austerity measures. We see countries like Italy being hit very hard by this, because also countries like mine have implemented those policies. And I think what would be the question now for us as progressive actors or socialists is, what can we do to cope with this? What are solutions? I mean, we have countries like Spain that are nationalizing their healthcare systems. Is this a way to go to cope with this? Or we see countries like Portugal, who are actually making their healthcare system accessible for very vulnerable people, for migrants. So we see good examples. Of course, on the other hand, we have countries like Hungary that are working on the erosion of democracy, the Philippines as well. Yeah, what are measures that you think we should implement or we should fight for together? And I think we should keep the order and start with Julia then.
Okay, so from what I heard, I think that we are all facing similar situations, all about the test, and all of that is very similar also here in Italy. I didn't mention it before, but we think we have between 5 and 10 times the positives and about the double cases of deaths. So even here, I think that they are trying to don't do as much tests as we should do, just to keep like a kind of low profile for an economy reason or whatever. Of course, the coronavirus crisis is showing all the inequalities already present in the Italian society. I'm thinking about the labor market, for example. We have a lot of workers left without welfare, unemployment aid, or layoff because of the labor market reforms done in the last 10 years. A lot of people were working in what we call the black market, meaning that they are working in small business, stuff like that, so they have not a legal contract, so they have no way to have financial aid now. And also here, the government has been quite slow in giving answers to the people. I'm still waiting my financial aid since I think 4 weeks, and same situation are facing a lot of young workers like me, especially self-employed workers. There is a problem about the housing, because we have a huge housing problem also here in Italy. There is no social housing, so a lot of families are facing the lockdown in the streets without a place to stay. There have been already some protests, especially in South Italy, which is the poorest part of the country, because people cannot afford to go to the grocery store or to pay rent. And there haven't been a real answer by the government. Also, I would mention the schools, because there are a lot of inequalities in the access to education. And now, since the lockdown broke, we are trying to have an e-learning new system, but the Italian school system was not ready at all. And so a lot of families in Italy have no connection. They don't own a computer. So we have 1,000 children without any form of education. Of course, years of austerity have left the Italian economy quite weaker. The good thing is that we have a universal healthcare system, so actually everyone can go to the hospital, no matter who you are, if you are foreign, if you are an immigrant. It's free, it's public, and it's universal, so that's a good thing because everyone can be helped. Of course, right now the hospital are the major side of spread out of the virus. That's the reality, because of a lot of different reasons. There are problems of overcrowding in the prisons too, as Justine mentioned here. Also here, there have been riots and some prisoners have been able to escape. There is a problem of democracy because with a lockdown and a quarantine, the parliament can converse very rarely. So everything is in the hands of the government and of the prime minister. And we don't have, I mean, here in Italy, the political system is already, how can I say, very complicated. We don't have a left party, basically. And no one is ready at the end of the crisis to collect those instances, to collect all those requests for basically protection, welfare, and equalities, social rights. And that makes everything more complicated. Because again, it's very difficult to have the democracy going on and continue. I think almost here in Italy, we need a political subject also to reverse the current narration of the situation. And I think that the whole point now is who is going to pay this new crisis, because after 2019, has been the low and the middle classes, the young workers, the poor families, the immigrants. For example, we have a lot of immigrants who are pushed by their employees to keep working, for example, in gig economy or in agriculture, and they cannot refuse it because they have temporary visas or they don't have a visa at all. So I would say that the whole political point here is who is gonna to pay that crisis again, and who and how can we reverse what happened after the last crisis. And of course, I think at least here in Italy, we need to have different, how can I say, strategies than the last time. So no austerity, no spend review, and all of that.
Thank you. Justine, do you want to continue?
Thank you. In what we progressives should do and should remember, the challenge for us ahead is that while we are being asked to observe social distancing, it's also the best time to observe social solidarity. At the time when the crisis hit, people, workers, and coming from different walks of life were the first ones to step up and provide the solutions that were missing from our health infrastructure, from our systems. Like, for example, when a community quarantine was called, there was a lockdown throughout the city. A problem was there weren't enough transport systems for the health workers. So imagine hospitals didn't have nurses and doctors for a day because the government didn't plan how to do the lockdown at that time, and leaving health workers stranded in their own homes and not being able to take care of the crisis that is happening in hospitals. And so ordinary citizens and workers started doing a carpooling system in order to ferry health workers from their homes and to the hospitals for free. At the same time, when there were cases of domestic abuse or people feeling unsafe, especially women who feel unsafe in their homes. Feminists here started coming out with a chat box and a hotline that people can call if they are distressed, if they need help, or if they need to report someone who is harassing them, or if there are cases of violence at home. At the same time, you'd also hear stories of workers providing their fellow workers with food packs, with health kits at the start of the crisis because there weren't enough for them and there weren't anything provided by the government. And then you'd also see local governments stepping up and using what little resources they have in order to provide accessible treatment and testing for people. And so you'd see local governments taking this pandemic really seriously and ensuring that not only are people staying at home, but they're also provided with food, they're also provided with security, and at the same time, they're also provided with transparency on what is happening and how is the government responding. And those are the kinds of things, and those are the kinds of stories that we progressives should amplify. Because these are not stories of, these are not acts of philanthropy, but these are acts of solidarity. And I think this is a sneak peek into what system what the new system would look like after this pandemic. And of course, our role as progressives would be to be very vigilant about how conservatives or the far right would take advantage of this crisis. The vigilance of progressives and ordinary citizens here, one, hazard pay and special risk allowance for health workers, because at the start, the government only wanted volunteer health workers, and there was a huge protest online, and that forced the Ministry of Health to change their policy, and now they're providing hazard pay and payments to health workers. At the same time, there was the health ministry didn't want to adopt mass testing as a policy at first. There was a huge protest online, and now they are announcing slowly the benefits of mass testing and how they're going to roll that out. The other policy that we want to win and are continuously organizing for is providing financial assistance and income guarantees for people, especially that it seems that the lockdown in here would span for 2 weeks more or so.
Okay, thank you. Then I think we'll continue with Marianela and then Jess and then Matthias.
Yeah, thanks. So, I think especially compared to maybe other countries that have even just marginally more socialized health systems, the obvious demand in the US is to have even just a public health insurance system. Of course, the idea, I think, of nationalizing the entire healthcare system is still quite a ways away in terms of the realm of possibility, but the demand for the last several years has been Medicare for all. So a nationalized health insurance system that covers everyone. Currently in the US, there are 28 million people who don't have health insurance. And even of the people who do have health insurance, there have been sort of surveys that show that a majority of people who have health insurance, or almost a majority, around like I think 46 or 48%, have inadequate insurance, right? So they have insurance, but they can't use it because the payment that they still have to make when they go to the hospital is so high, or because they have a yearly deductible that is something like $7,000 or $10,000. And so before their insurance even kicks in, they have to spend that amount of money. So I think that, to me, that is the horizon here. There are also things, I think I didn't mention this earlier, but the question of testing, I think, has been particularly egregious here, with the WHO sort of offering the test in late January to the US government, and the government refusing it and opting to develop tests here, which didn't happen apace at all. And then certain states or cities choosing to develop tests themselves, which has led to incredibly uneven testing across the country. I think, like we've heard from other examples, sounds like Italy is similar. I think it's really shed light on the fact that the entirety of the medical equipment production industry and the pharmaceutical research industry are entirely profit driven. And so, for example, I was just reading a few days ago that there was a company of several years ago that was contracted to produce a small portable ventilator. That company was then bought by a larger company that completely scrapped the project because it was not profitable enough. So it's those kinds of things that are so intrinsic to, I think, a for-profit economy that need to be dismantled. And so, of course, we need to start, or we need to continue to demand Medicare for all, but we also need to move into thinking about how to decommodify the basic industries that are necessary for everyone, and to run those industries for the public good and not for private profit, as I think we all know. And then I think there's another question of what are the sort of emergency measures that are needed in this moment. So for reference, just I think about 10 days ago, the US government passed a huge stimulus bill, as sort of an emergency package that includes up to $4.5 trillion for corporations and loans. And for comparison, only $30 billion for hospitals and medical equipment. So that's a difference of about 150 times. At the same time, that bill included individual assistance to people in a single check of $1,200. And so we know that this is like incredibly inadequate. Most people in a lot of cities, $1,200 is not even enough to pay rent for a month, let alone things like healthcare or health insurance premiums or groceries, things like that. And so I think that, you know, I'll say personally, as a socialist, I think as socialists, we have to think about what is our response in this moment, in this emergency moment. What do we demand? I think, for example, what we've seen occurring in some European countries, where the government will reimburse companies for keeping employees on the payroll, so making sure that people will still have jobs even after the crisis is over, is potentially preferable to the option that's been presented in the US of a monthly cash payment from the government directly to individuals. That means that people can still get laid off, and most companies will take advantage of that payment to lay people off. And so I think we have to think about what are the emergency measures that we want to demand, and then how do we go further than that, right? What is it that we want to rebuild? This crisis is going to decimate most economies, and I think create a huge gap both for the right and for the left to move into. And I think we have to continue broadening our horizons and continue to wage fights for things like in the US, Medicare for all, a Green New Deal, canceling student debt, which is another huge crisis here, and further sort of pushing the agenda that, you know, our society should be run for people and not for profit.
Okay, so you're basically also saying that it's easier now to demand our like socialist projects like the Green New Deal. I mean, it's not only a topic in the US, but also in a lot of European countries. And I know, like, we had a talk with Justine before also, that in Asia it's also a big one. So maybe that's one of the topics we can work together on. But Jess, you can continue, and then we'll have Matthias.
Yeah, I think we have quite a number of parallels with the US in some of these areas. Obviously the stark difference being that we do have the healthcare system that is, you know, free for all at the moment. I think that we're in a kind of unique position in that, you know, go back to December, we were fighting a general election where all of the socialist principles that we were putting forward were painted as completely unachievable, you know, way beyond anything that the country could afford. You know, the phrase like the magic money tree was thrown around repeatedly, and you know, in the end we returned a far-right conservative government. But what we're seeing now is that they are actually having to implement some of these policies that we were putting forward, that they were painting as completely impossible. So they're trying to reshape themselves in a way as being on the side of public services, which is a huge U-turn from where they were you know, 2 years ago, for example, when they were openly having conversations about the fact that, you know, the NHS maybe needed to shift to an insurance-based healthcare system similar to the US. So I think what we are seeing is that there is a space right now for us to be driving forward these socialist policies, and making sure that we don't give them a free ride on, you know, going back towards the right-wing arguments for this. The thing to be careful of, I think, as well, is like, you know, free healthcare is absolutely essential, but we need to be pushing for properly funded free healthcare, because otherwise we fall into the trap of them saying that free healthcare is poor quality, which what we've seen in the UK is that if they reduce funding, the quality of care goes down, and then the argument tends to grow, and public unhappiness with the service that they're getting grows, so they tend to shift to looking to other solutions. But the reality is, if we properly fund our healthcare services, then they are the best in the world. So I think that that's clearly an area that we all need to be pushing for. Here, I think one of the really big concerns is the lack of personal protective equipment for our healthcare workers. So internationally, I think that's something I've seen in a lot of other countries, completely unequipped to deal with this kind of crisis. We've got doctors here using snorkels as protective equipment, which is completely absurd. And the government have been way too slow to react to get PPE for our healthcare workers. So I think that's an area that a lot of countries are struggling with, and if we unite on that, that's definitely an area, you know, internationally, that we can all be pushing forward. Along with that, I think the big issue here is around how we support workers to unionize, to demand their rights moving forwards. And I think right now is a good time to be doing that. So we have had, you know, the government introduce a pay package for some workers. It's 80% of their pay they'll be paid, but it doesn't apply to a lot of workers. So it doesn't apply to people on 0 hours contracts, which makes up a huge amount of our workforce. And it doesn't apply to self-employed people, and it doesn't come into play until 6 weeks after they announced it. So one of the most successful actions we've seen here is the Wetherspoons workers, which I think is around 45,000 employees, organised against Wetherspoons to out them that they weren't going to pay them until the government 80% came in, which meant they were without pay for work that they've done. So they have been organising a very public campaign against their employers' actions, and that's been really successful, and the employer has actually done a U-turn, which means that those 45,000 employees will get that 80% pay. But I think the important thing is that we don't stop there. We demand that the workers get 100% pay. You know, they get the pay that they for the labour that they have done. So there's definitely a space for organising with workers to ensure that after this, we never return to a situation where their work is so precarious, where their work is so low paid, and where they have so little rights in their workplace that they can be laid off without the pay for the work that they've already done. Also, it's been, you know, it's been heartwarming to see some of the solidarity that we've seen, like in our local communities, but also internationally. So the Cuba healthcare workers traveling to Italy, that was really important. I think that where we can show solidarity in the healthcare sector, but also the community COVID responses that we've seen. Really important. I think that we are, as the left, seem to be supporting that and doing everything we can to make sure that community solidarity is talked about, and that we moving forward, that's an attitude that we can change in our very local communities, where we have shifted towards that more looking out for each other, and that's often like reflected in the way that people vote. You know, voting for myself and my own interests, but in in reality, actually, we need to be thinking about how, as a community, we work together. And as socialists, I think we've got a responsibility to be driving that forward.
I can fully agree with a lot of the things that have been said already. I think I would divide it into two phases. I think we need to bring the pandemic under control at this point, and that means this kind of lockdown, and I think the comprehensive testing that is not taken care of, and I think this has to happen as soon as possible so we can loosen the lockdown. I think it has a huge impact on people, on mental health. We know domestic violence, and I don't think we know anything because people don't go outside anymore. So I think they're just, yeah, there's a lot happening we are unaware of. We also see this in our educational system where many kids or youngsters, they depend on school, they depend on a special support that they receive there. With parents at home, maybe now I'm not sure if they will get a job after everything opens up again. We had this kind of state aid for companies where they would pay large amounts of the wage of the workers so that the companies would not push them out. We still have had our unemployment rate double, so we have now 12.2% unemployed in Austria. There are protections for unemployed, but of course they are much lower, and this is a huge number, and it's still rising. We don't know when it will go back. I think some kind of lockdown we will have for at least a year or longer, and that means certain sectors of our economy. So we depend to some extent on tourism. Other countries like Italy do much more. So I think these are sectors that will not reappear in the summer, I think. And so there are many impacts that will come gradually. Yeah, and when it comes to labor, it's similar to the situation in other countries. Precarious work has been hit hardest. So it's still, I think there are many battles, and I think something that became visible and that gives me a lot of hope is that I saw a lot of solidarity on so many different levels. And I think this is between different groups that didn't have much in common, but also the technical university reached out to us in the hospital to make a program for us to do our shift scheduling. We had 3D printers association against coronavirus with 100 3D printers that said they want to 3D print stuff if we need any. And of course they do it for free. But I'm, like Justin said, I think much of the work has to be paid, and also the government wanted to have volunteers, and while they're now paying them, others, we still have obligatory civil service, they are getting paid less. So I think there's many issues, but there's a general attitude towards we're in this as a community, and this holy individual that should in its holy alliance with the market create the best of all worlds. Nobody's believing this anymore, and I think there's a huge shift towards the need of working healthcare system and welfare sector, but also of what work actually matters in society, and that it's actually the one that it's worst paid, and that's mainly done by women. And I think this is something that just is becoming visible now, and I think it provides a huge opportunity for us, because we will face a large economic crisis, and I think the answer cannot be the same as the last time. And I think as socialists, we now have the chance to really put forward a vision and put forward a program on how we want the economy to be reshaped after it, because it will change, and I think we have to fill the gap.
Okay, thank you, making us very hopeful, saying that this will last over a year. But I would continue with some questions from our viewers then. And one of them is basically from Thomas, and he's asking, the left is very much divided on the strategy of or on the implementation of a universal basic income, but we see that some parties are adopting it right now. What is your standpoint on this? And then we have another question from Alexei, and he's asking what we can do, like fighting against the erosion of democracy in our countries. That it is basically, I mean, we've seen some governments exploiting the coronavirus to basically like militarize our everyday life. What can we do about this? And I think we can go the same order. Julia starting.
I'm sorry, I lost some part of the conversation. Are we asking to all the questions at one time or just the first 2 questions?
I would do the 2 questions now, and then we'll see how much time we have left.
Okay, for the universal basic income, I think that we don't have to think that the labor is finished, that it is going to disappear. And so we need to discuss a lot about universal basic income because until we are still working, I think maybe we should talk more about a universal income against poverty, more that general basic income. And thinking about Italy, now the 5 Stars movement launched that campaign for reddito di cittadinanza, so like citizen income, kind of. But the result is that no one is getting as much money as they were hoping for. So it's such a small little ad that goes to people that is a very, very serious poverty situation, because you don't have to own a car, you don't have to work, you don't have to have a family, so it's very complicated. And I think that maybe the same amount of money can be used to improve the welfare or in general the labor. Then I know the Italian system, so that's how I think it should work here. Then I don't know in other countries. And so yes, of course we need to talk about it, but I don't think it can be like the final answer against poverty, welfare, and the lack of employment, basically. And about democracy, as I was saying, is very, maybe because here in Italy we have experienced already more than 1 month of lockdown, it's very hard to keep the democracy working. Of course, the government prime minister have more power now than before. But for example, in Italian case, we have a very strong anti-fascist constitution. So there is always a kind of balance between the different powers. So I don't think that for the moment we have the same risk as Hungary, or at least I hope so, because really the constitution we have and all the system we have, where in Italy the parliament is the first power against the government and all the other powers, that there is this kind of balance in every single act. And I think that the best way to ensure the democracy is to reinforce the parties. Basically, having a strong parties makes the democracy working better, because you have a critical mass against what the government is doing, and a way to protect the democracy. Then, as I was saying, in Italy we don't have a left party at the moment, so that can be a problem for us. But just generally speaking, yes, working on the party and build a strong left party in that case, claiming all that we said.
Okay, then I would say, because we don't have that much time any longer, that you keep it short if it is possible, and that you don't have to say anything. If you want to comment on the question, then just go ahead. But when we're going with the order, then it will be Justine next.
Yes. On the question of universal basic income, here in the Philippines, the policies around wages, I know how it's different, maybe in different European states, as it's won by industrial bargaining agreements, but in here, it's largely revolved around wage councils that differ from regions to regions, and we also have a minimum wage law. And so a lot of policies around wages or income revolves around legislation. We've realized that at the time of the pandemic, the aid that comes from the social ministry and the labor ministry are very limited from what every worker receives from day to day on a regular situation. The aid that they receive from the government is only 23 to 50% of what they receive. And so our call is, and the problem here is that it's targeted, and some there are quota systems per city, and so you don't reach everyone who actually needs the support. So our call here is that the government should seriously study the possibility of having income guarantees, albeit it might differ from regions to regions, but what's important is that people will still feed, a family of 5 will still feed 3 children, or a family of 5. They will still have to pay rent, they will still have to pay bills. They couldn't afford to just live on paltry support and meager aid for 1 to 2 months. They cannot stretch their budget. And so our call is for governments to seriously study the possibility of giving income guarantees.
Okay, then Marianela or Jess?
I'll just say very quickly, since I know we don't have a lot of time, you know, in the US, we're still in the middle of a primary election with a general election happening in November. And most states have been forced to postpone their elections to a kind of hopeful date in June. And with very little clarity about whether that is actually going to happen. Wisconsin, a state in the north of the country, is having an election tomorrow. It's very uncertain what's going to happen. And so I think this crisis has really put into question the legitimacy of an already quite eroded American democracy. I think it's going to be something that both the federal government and state governments have to answer for a very, very long time, whether this election was even legitimate at all. So it doesn't quite answer the question of like what to do, but it's certainly a problem that we're dealing with here. And I think across the country, we'll have to put the left will have to put a lot of, or across the world, the left will have to put a lot of pressure on national governments to answer this question.
So on the question of democracy, I mean, things here are quite mixed. Obviously, we have the government here sort of more often than not are less keen to implement state intervention than they are. So the bigger problem here I think we have is that the Conservative government currently tries to kind of rig the system by changing the boundaries in which people are elected to favour themselves. So they return more MPs, and they've been looking at introducing compulsory ID to be able to vote, which means people have to pay, you know, £80 for a passport to be able to register to vote. So they're creating boundaries for usually young people or poorer people having access to the democratic processes. So I think one of the most important things we do is have a really powerful and coordinated campaign against that when the government inevitably tries to bring that in. So that's what I would say in terms of democracy. On the question about universal basic income, I think that that's probably going to be something that more and more we're going to have to be looking at, particularly when we're pushing forward things like the Green New Deal, and when we're looking to shift our economy into a sustainable based one, where we're going to have to be having conversations about well-paid, green, meaningful jobs. So universal basic income is going to have to be an ongoing debate, but I think, again, it's important to remember that it's not the be-all and end-all and solution to all of the inequalities that we see. Like things like the housing crisis, people will still be living in appalling conditions with or without universal basic income. So we need to look at transforming society as a whole and shifting wealth from the handful of 1% into the hands of the majority of the population, and ending the staunch inequality that we currently see.
Yeah, I believe too, for the universal basic income, I think a workplace guarantee makes more sense to me, and a backup system that is just extended to the groups that are currently not covered and is properly financed. I don't think everybody is the same, and there are people with special needs, and you would still need to modify your universal basic income. And then there are just a lot of people that do not need a universal basic income, like people that are working. I don't know why we should support every company and pay their workers money. I think it makes more sense to look towards providing a workplace for everybody, in particular in the sectors, and moving our economy towards a sustainable one. I think that would be one of these changes I think we should be pushing for. And for the question of democracy, I think things will be different, and also political work will look different. And I think we as the left have to think of how do we do that, what the tools we used and the way we worked until now, they will maybe not be so easily possible anymore, but maybe there are other ones. And I think the distances internationally became relatively shorter through the lockdown than they were before. So I think building on that, and also on the similarities that we face and the experiences we have in different countries, can be a huge chance, because yeah, I think we need it desperately.
Okay, then maybe we'll do a round of, you already said that international solidarity is key right now, of like, what are your ideas, how we can support each other, or things that we can do from our countries to support you. Don't know who wants to start here.
I mean, if you want, I can just keep going the same order. So in the last weeks, Italy have received medical and technological support from countries like Venezuela, Cuba, Albania. Russia sent us military doctors, epidemiologists, masks. China, same doctors and technologists and stuff like that. So I think it's interesting to read through the lines when it comes to the priorities of every country who gave help, and try to take from that some hypotheses about the future international phase and development. Instead, it's not very clear when it comes to European institutions how they will support the first countries affected by the coronavirus, as Italy or Spain, to face this crisis. I think that most of the economics agrees on the fact that we need expensive financial tools, more now, even more than before, that may probably launching the Eurobond program is at that stage already not enough to face the financial and the real economic crisis that all Europe will face. And I think the most important, the European Commission should agree with the fact that EU and not just Italy needs both Eurobond. What we are missing, I think, at least in Europe, is fiscal stimulus, an European-led aid program. I think that we need to provide for fiscal capacity in Europe at the Eurozone level. I think we need to do a structural reform in order to compensate the institutional failures of the European architecture. And I think that this epidemic is not the end of the globalization, but I think that is gonna to change in a way that is very hard to predict, and that is linked to the fact I was talking before about the global order and the health, etc. I think that we need to work all together on a transitional political and cultural movement, able to claim healthcare for all, expansionary policies, social rights, all that we talked about in the last 1 hour. I don't think that ideologies are dead. I think that the word socialism still means something, and I think that we really need it to, in order to change the actual power upward all around the world. So just do it together, I would say.
Right now, aside from the technical and the financial cooperation that is being shown and negotiated between governments, and at the same time ensuring that protective equipment and other important gears are provided for every country, our roles as socialists, social movements, and different youth groups is to share these stories on what worked in our countries, on what our situations are, because from the past hour, I've really seen how some of the issues that we've fought or have already won here are also issues that are happening in different countries. And so stories and struggles that we can share and learn from each other are really important for all of us to survive this pandemic, and at the same time win a new system that would help people take back control of the economy and politics. Because at the same time, while the nationalists and the far right seem to have a shared, I don't know, a group chat, so where they can share strategies and tactics on what they can do in order to repress more people and use this crisis to their agenda. All the more that progressives should have a shared strategy of how we can further unmask the rottenness of the capitalist system and be able to express solidarity and open up a new system where people can come together and take care of each other.
Yeah, I think the ruling class has a lot of class solidarity, and I think it's on us as socialists and as leftists to build our class solidarity across the international working class. And so I think things like this are really essential for doing that. And then I also think, you know, as things continue to escalate, which I think that they will, we need to be continuing to foster these relationships so that we can align on tactics, right? So even just over the weekend here, near where I live, Amazon workers at a distribution center went on strike. And those are the kinds of actions that have the power to be coordinated, not just across a single country, but across the world. So yeah, I mean, I'm grateful to be here with all of you. And I think that there's a little bit of a silver lining to all of this, which is that I think, like Matthias was saying, the distances between us have become maybe a little bit smaller, and so we can continue to work together and forge these relationships.
Okay, Jess, do you want to?
Sure, yeah. I think I just echo what's already been said. I think obviously we have the struggle of anti-trade union legislation restricting the action that we can take in our workplaces, but I guess the current situation that we're in means that the struggle that workers are in is reflected internationally, and so making sure that we are communicating, you know, works, for example, similarly in warehouses in the UK are taking action this week. It's important that we are communicating internationally to make sure that those workers have the chance to cooperate and to make sure that they are supporting each other, because obviously, you know, some of the most successful strikes in history that have changed corporations' responses to workers have been international. So I think that that's something we can definitely do to support each other. And obviously, as already mentioned and has been said already, I think the campaign for PPE is absolutely essential right now. That has to be an immediate focus for every country that doesn't have proper PPE for healthcare workers, because they are, as we speak, at risk every day that this crisis continues. So if there is ways that we can work together to coordinate a campaign to force all governments to introduce proper protective equipment for all workers, then that's something that we need to do. And I guess moving forwards in the long term, when we are kind of through with this, I think there's something to be really cautious of in terms of the far right. As we know, they rise up when, and they kind of foster when there is staunch inequality, when there is deprivation, when there is economic crises, which we are looking to find ourselves in. All of us will find ourselves in when we come out of this healthcare crisis. And so I think it's important that we work together to make sure that we are putting forward socialist solutions and communicating those to the public, to make sure that this isn't a vacuum where the far right are allowed to grow and threaten our societies.
I can equally echo a lot of the stuff that has been said. I think it's a big chance that we have now. I think there are urgent issues. In particular, in our country, we have a chancellor that is always pushing for Austria first, even if it's a very small country, and feels very important in doing so. But I mean, if there are more wealthy countries in the global north that buy up all the medical equipment, we will leave even the hospitals empty in the global south. And I think this has to be coordinated, and I think pushing for that would be something that's urgently needed at the moment. And now building while we're all under lockdown and learning from each other. And I think then also developing campaigns. I think Amazon made a lot of profits. It didn't pay taxes anywhere. I think that would be a good start for them to pay the proper taxes everywhere. So I think there's different things where we can look into, but I think, yeah, and we need it. We know socialism doesn't work in one country, so let's use that.
Okay, then I would actually wrap up, and thank you all for participating in this talk in one of our first ones. And I think what we've seen, yeah, I can also only echo what you've said. Like, what we see is also that, like, it's not the virus that kills us, but like the attack on the welfare states, and that we're much more interconnected than the economy wants us to believe. But that these talks like this and international solidarity can actually make us feel better in a time where we see like borders being erected again and closed, which feels very scary. Yeah, so this was one of the first talks that we had. You will find the recording on the page of Solidarität and also on their YouTube channel, I believe. We will continue in 2 weeks and want to talk a bit more about the global south, because this is one of the areas where we see that inequalities were even higher than in our countries before, and are even more reinforced. And I think what we've seen today is also we've got like an overview of the situation, but this crisis is like affecting all kinds of sectors in our lives. And we want to share some more light on some of the issues that we're facing in the next few weeks. So thank you for participating, and thanks everyone for watching. And then we're done.
Thank you.
Bye bye. Ciao.
Ciao, grazie.
Thank you very much.